The fluorescent lights of Mercy, General Hospital's emergency room, buzzed with their usual mechanical hum, casting sterile white light over the chaos below. Natalie Brooks moved through the organized pandemonium with practiced grace. Her scrubs somehow still crisp despite the 12-hour shift that was nowhere near ending. She had been a nurse for 7 years, and in that time, she had learned that the real emergencies were not always the ones that came through the doors screaming. "We've got another one," called out Jamie, the triage receptionist, her voice carrying that particular tone of weary dismissal that made Natalie's jaw tighten. "Looks like he's been sleeping rough. Smells like it, too. Says he's got chest pains, but you know how these types are." Natalie did not respond to the implication. She simply nodded and made her way to exam room 4, where a man sat hunched on the edge of the hospital bed. His clothes were legitimately filthy, layered in a way that spoke of sleeping outside through changing temperatures. His hair hung in greasy strands around a face smudged with dirt, and the acrid smell of unwashed human being mingled with something else. Something almost medicinal that Natalie could not quite place. "Good evening," she said warmly, meeting his eyes. They were startlingly clear. She noticed a sharp gray that seemed almost incongruous with the rest of his appearance. "I'm Natalie. I'll be taking care of you tonight. What brings you in?" The man studied her for a moment, as if surprised by the genuine kindness in her voice. "Chest pains," he said, his voice rough but educated. Another small inconsistency that Natalie filed away without judgment. "Started about 3 hours ago. Comes and goes. Okay, let's get you checked out." Natalie washed her hands thoroughly and pulled on fresh gloves without any hesitation or visible distaste. "I'm going to take your vitals first, and then we'll get the doctor to examine you. Have you experienced chest pains before?" As she wrapped the blood pressure cuff around his arm, she noticed his hands. They were dirty, yes, but beneath the grime, she could see that the nails were not broken or yellowed as they would be after months on the streets. Another inconsistency, but people ended up homeless for all kinds of reasons and on all kinds of timelines. "No, never," he replied, watching her face carefully as she worked. "I've been pretty healthy until recently. Your blood pressure is a bit elevated, which could be from stress or anxiety. Or it could be related to the chest pain." Natalie made notes on her tablet with efficient taps. "Any history of heart disease in your family?" "My father had a heart attack at 53. Natalie looked up at that, her expression serious. "Then we're definitely going to take this seriously. I'm going to get Dr. Patterson to see you right away, and we'll probably want to run an EKG and some blood work. Is there anyone we can call for you?" The man, who had given the name John Pearson at intake, shook his head. "No one to call?" Something in the way he said it made Natalie's heart squeeze with familiar sympathy. She had heard that particular brand of loneliness 1,000 times in this emergency room. "Well, you're not alone right now," she said simply. "We're going to figure out what's going on and get you feeling better." But the emergency room was in one of its periodic surges, and the doctor was currently dealing with a car accident victim in trauma. 1. Natalie returned to check on her patient every 10 minutes, bringing him water, adjusting his bed to make him more comfortable, and simply talking to him about anything other than his circumstances. "You're different from the others," John said during one of these visits, his gray eyes studying her with an intensity that should have felt uncomfortable, but somehow did not. "The other nurses, the receptionist, even the orderlies, they look at me like I'm trash that wandered in off the street." Natalie settled into the chair beside his bed, checking her watch to ensure she had a few minutes before she needed to check on her other patients. "Everyone who comes through those doors deserves care and respect. That's not naive idealism. That's just basic human decency. Most people don't see it that way." "Then most people are wrong," Natalie said firmly. "I've treated CEOs and homeless veterans, and I can tell you that pain doesn't discriminate. Neither does fear. When you're lying in a hospital bed wondering if something's seriously wrong with you, your bank account doesn't matter one bit." John leaned back against the pillows, something shifting in his expression. "You really believe that?" "I know it." Natalie stood up, smoothing her scrubs. "Let me go chase down Dr. Patterson again. You've been waiting too long." What Natalie did not see as she left the room was John pulling out a smartphone from beneath his layers of clothing. one far too expensive for someone truly living on the streets. He typed a quick message, his jaw tight with something that might have been shame or might have been revelation. When Dr. Patterson finally arrived, his examination was cursory at best. He asked a few perfunctory questions, barely listening to the answers, and was clearly eager to move on to patients he deemed more deserving of his time. It's probably just anxiety, he said dismissively. Given your living situation, that wouldn't be surprising. I can give you some information about shelters. Natalie, who had remained in the room during the examination, spoke up. Doctor, given his family history, shouldn't we run an EKG and cardiac enzymes? Chest pain with his risk factors warrants further investigation. Dr. Patterson shot her an irritated look. Nurse Brooks, I've been practicing medicine for 20 years. I think I can determine what tests are necessary. With respect, doctor, our protocol for chest pain with cardiac risk factors clearly states that we should run those tests regardless of other circumstances. Natalie kept her voice professional but firm. Meeting his gaze steadily, the doctor's face reddened. Fine. Order the tests, if it'll make you happy. But we both know we're wasting resources that could be used on real patients. After he stormed out, Natalie turned back to John with an apologetic expression. I'm sorry about that. Some people let their prejudices get in the way of good medicine. But we're going to do this right. Why? John asked quietly. Why fight for someone like me? Natalie began setting up the EKG machine, her movements efficient and practiced. Because you're not someone like me. You're a person who came here for help. That's all that matters. Besides, what if we sent you away and you had a heart attack tonight? I'd never forgive myself for not doing my job properly. She placed the electrodes on his chest, carefully cleaning the skin first with professional detachment that somehow still conveyed respect. John found himself experiencing something he had not felt in years. Genuine humility. He had come here tonight as part of an elaborate test, a way to expose the cruelty and negligence he suspected ran rampant in public hospitals. He had planned to use the experience as justification for his company's new policy of only supporting private healthcare initiatives that served paying clients. Instead, he was being cared for by someone who had shattered every cynical assumption he had. Brought through those doors, the EKG came back normal. But Natalie insisted on waiting for the blood work before discharging him. She brought him a blanket because he mentioned being cold, found him a turkey sandwich because he had not eaten that day, and never once made him feel less than human. Do you have somewhere to go tonight? She asked as they waited for the final results. The temperature's supposed to drop below freezing. I'll find somewhere. Natalie pulled out a printed list from her pocket, one that looked like it had been folded and unfolded many times. Here are the shelters in the area that have open beds tonight. This one, she pointed to a name highlighted in yellow, has a good medical clinic attached if you need follow-up care. And this one serves hot breakfast. John took the paper, staring at it as if it were something precious. You carry this in your pocket? I hand out about 5 a week, Natalie said with a small shrug. A lot of our patients don't have regular housing. The least I can do is point them toward resources. When the blood work came back normal, Dr. Patterson discharged John with barely a word. Natalie walked him to the exit, her shift finally over after 14 hours. Thank you, John, said at the hospital doors, and he meant it more deeply than she could possibly know. You've given me a lot to think about, Natalie smiled, the expression lighting up her tired face. Just take care of yourself, okay? And if you have any more chest pain, don't hesitate to come back. As she walked to her car through the cold Pred-on darkness, Natalie did not think anything more about the patient named John Pearson. He was one of dozens she would see that week, each carrying their own stories of struggle and survival. But John stood in the parking lot long after she had driven away, watching the hospital entrance with an expression of deep contemplation. He pulled out his phone and made a call. Cancel the expos, he said quietly, and set up a meeting with the board. We need to completely restructure our healthcare initiative. I've been approaching this all wrong. It's Jonathan Pierce, CEO of Pierce Medical Technologies and one of the wealthiest men in the country, climbed into the luxury car that had been waiting 3 blocks away and rode back to his penthouse apartment in silence. The designer stubble he had grown out and the professional makeup that created the illusion of deeper dirt were already itching to be washed off. but they felt like the least of the disguises he had worn that night. He had tested Natalie Brooks to see if compassion was real or just performance, to see if anyone would care for a person with nothing to offer in return, and in doing so, it revealed something far more uncomfortable about himself. The boardroom of Pierce Medical Technologies occupied the entire 47th floor of the gleaming downtown skyscraper, with floor-to-ceiling windows offering a view that cost more per square foot than most people earned in a year. Jonathan Pierce stood at the head of the obsidian conference table, his tailored charcoal suit and platinum cufflinks a stark contrast to the homeless man who had shuffled through Mercy General's doors 3 weeks earlier. Our new healthcare initiative will focus on community hospitals and clinics serving underserved populations, Jonathan announced to the 12 board members assembled before him. We're restructuring our entire charitable foundation to prioritize access over prestige. The reaction was immediate and predictable. Richard Ashford, the company's chief financial officer, leaned forward with barely concealed frustration. Jonathan, we've already committed $5 million to the cardiovascular wing at Premier Hospital. Their donors gala is in 6 weeks. This is a public relations nightmare, and we'll handle the public relations, Jonathan replied coolly. But I'm not interested in putting our name on another marble-floored facility that turns away patients who can't pay. We're going to invest in places that actually serve their communities. This is about that stunt you pulled, isn't it? Margaret Holloway, the longest-serving board member, removed her reading glasses and fixed Jonathan with a sharp stare. Dressing up like a homeless man and wandering into emergency rooms, what were you trying to prove? Jonathan's jaw tightened. I was trying to understand what our healthcare system actually looks like for people who aren't wealthy enough to buy their way past the problems. And what I found was both worse and better than I expected. What he did not tell the board was that he had visited 4 different hospitals over 2 weeks, before ending up at Mercy General. At the first 3, he had been ignored, dismissed, and in one case physically removed by security despite his complaints of chest pain. Those experiences had only confirmed his cynicism, his belief that the system was broken beyond repair, and that throwing money at public institutions was pointless. Then he had met Natalie Brooks, and she had complicated everything. We have a responsibility to our shareholders, Richard insisted. These community hospitals you're so enamored with don't generate positive press. Premier Hospital puts our logo in front of the city's most influential people, with the kind of controlled anger that made seasoned executives nervous, is to actually improve healthcare outcomes, not to buy our way into country club conversations. This discussion is over. The initiative moves forward as I've outlined. After the board members filed out with varying degrees of displeasure, Jonathan remained at the window, staring out at the city below. His assistant, Patricia Kemp, appeared at his elbow with her ever-present tablet. Sir Derek Hamilton from Mercy General Hospital has been calling repeatedly. He says it's urgent. Jonathan allowed himself a small, bitter smile. I'm sure it is. Did you arrange the other matter I requested? Yes, sir. Though I still think you should reconsider the approach. Noted. Send Mr. Hamilton in when he arrives. Derek Hamilton, Mercy General's hospital administrator, arrived within the hour. His handshake too firm and his smile too bright. He was the kind of man who had perfected the art of looking important while accomplishing very little. And Jonathan recognized the type immediately. Mr. Pierce, what an honor, Derek gushed, settling into the guest chair without waiting for an invitation. When I heard that you had visited our facility, I was mortified that we didn't provide you with the VIP treatment you deserved. If I had known who you were, we would have rolled out the red carpet. That's exactly the problem, Mr. Hamilton. Jonathan remained standing, a subtle power play that made Derek shift uncomfortably. The fact that you would have treated me differently based on who I was rather than what I needed tells me everything I need to know about your facility's priorities. Derek's smile faltered. I'm not sure I understand, I'm sure you don't. Jonathan moved to his desk and picked up a folder, flipping it open. I've been reviewing Mercy General's patient care records, complaint logs, and staff evaluations. Your emergency room has a 43% higher rate of patient complaints than comparable facilities. Staff turnover in nursing is at 68% annually. and your hospital has been cited twice in the last year for inadequate care of uninsured patients." The administrator's face had gone pale. "Now, Mr. Pierce, those statistics don't tell the whole story. We're dealing with a very challenging patient population, and our staff does their best under difficult circumstances." "Some of your staff does more than their best," Jonathan corrected, "which is why I'm here to discuss a proposal. Pierce Medical Technologies is launching a new initiative to support community hospitals. We're prepared to offer Mercy General a substantial grant, but it comes with conditions." Derek leaned forward eagerly, the complaints already forgotten. "We're very interested in partnering with Pierce Medical Technologies. What kind of conditions are we talking about?" "Complete overhaul of your emergency room protocols, mandatory sensitivity training for all staff, and the promotion of certain exemplary employees to leadership positions where they can effect real change." Jonathan paused, watching Derek's expression carefully. "I want Natalie Brooks promoted to Emergency Department Nursing Supervisor, with a substantial salary increase and the authority to implement new patient care standards. Nurse Brooks." Derek's surprise was genuine. "She's competent, certainly, but we have nurses with more seniority who would be better suited for a supervisory role." "Competent." Jonathan repeated the word as if tasting something sour. "I watched her fight with a doctor to ensure a homeless man received proper cardiac screening. I watched her treat a patient everyone else had written off as a waste of resources with more compassion and professionalism than your so-called senior staff showed anyone that night. She's not just competent, she's exactly what your emergency room needs." "This is highly irregular," Derek protested weakly. "We have procedures for promotions, internal candidates to consider. And you'll have $5 million to consider as well," Jonathan said bluntly. "The grant money is contingent on these changes, Mr. Hamilton. You can accept the terms, or I can take this offer to County General instead. They have similar problems but seemed more receptive to reform when I visited them." Derek Hamilton left 20 minutes later with a signed agreement that would transform his hospital's budget, though the fixed smile on his face suggested he was less than thrilled about the strings attached. Patricia returned after showing him out. "The other matter is arranged. Miss Brooks has been invited to lunch tomorrow at Meridian. She thinks it's a hospital fundraiser committee meeting." "Thank you, Patricia." Jonathan loosened his tie, suddenly feeling exhausted. "And please stop looking at me like I'm about to make a terrible mistake." "I would never presume, sir," she said, though her expression said otherwise. "I've simply observed that grand gestures and manipulations, even well-intentioned ones, rarely produce the results we hope for." She was right, of course. But Jonathan had spent 3 weeks unable to stop thinking about the nurse, who had seen a homeless man and treated him like a human being. He told himself this was about recognizing excellence and rewarding the kind of compassionate care his company should be supporting. He did not examine too closely why he had watched the security footage from that night a dozen times, or why his chest tightened when he remembered the genuine warmth in her voice. The next afternoon, Jonathan arrived at Meridian early. Securing a private corner table at the restaurant where business deals and power lunches played out against a backdrop of crystal chandeliers and white, he saw Natalie the moment she entered, looking uncomfortable in dress slacks and a simple blouse. Clearly borrowed from a closet that usually held scrubs and casual clothes, she spotted him and froze. Recognition dawning on her face, followed immediately by confusion and then something that looked like anger. "Mr. Pearson," she said carefully, approaching the table. "Or should I say Mr. Pierce? Because that's who you really are, isn't it?" Jonathan stood, caught off balance by her directness. "You know, one of the orderlies recognized you from a magazine cover. He's been dining out on the story of the billionaire who pranked our emergency room for the past week." Natalie remained standing, her hands clasped tightly in front of her. "There is no fundraiser committee, is there?" This was another test. Another game. "Sit down. Let me explain." "Explain what?" "That you lied to me? That you played dress-up and manipulated people to prove some point?" Her voice remained level, but Jonathan could hear the hurt beneath the anger. "I thought you were someone who needed help. I worried about you sleeping in the cold. And the whole time, you were some rich man conducting a social experiment. It wasn't like that." Jonathan gestured to the chair again, and after a moment's hesitation, Natalie sat, though her posture remained rigid. You're right that I deceived you, and I apologize for that. But what happened that night was real. The way you treated me, the care you showed, that changed my perspective on things I thought I understood. So this is what? Your redemption arc? Natalie's eyes flashed. You're going to swoop in and save the poor struggling nurse who was nice to you? I want to offer you a position, Jonathan began, but Natalie cut him off with a sharp laugh. Of course you do. Let me guess. Come work for your foundation. Or your company. Some cushy job where I can feel good about myself. While you get to feel good about rewarding the help who treated you with basic human decency. Position as Emergency Department Nursing Supervisor at Mercy General, with a salary of $120,000 and the authority to implement real changes in patient care protocols. Jonathan kept his voice calm. Though her words stung more than he wanted to admit, Pierce Medical Technologies is providing a grant to overhaul your emergency room, and I want you leading that change. Natalie stared at him, her anger momentarily displaced by shock. You can't just buy someone a promotion. That's not how hospitals work. It's actually with enough money, that's exactly how they work. But this isn't about buying anything. You earned this position 3 weeks ago when you fought for proper care for a patient no one else wanted to bother with. You earn it every day when you carry shelter information in your pocket and treat every person who comes through those doors with dignity. I don't want your guilt money, Natalie said quietly, though her voice trembled slightly. I don't want a promotion that comes because some billionaire played dress up and decided I passed his test. Do you have any idea how condescending that is? How insulting. Jonathan felt something crack in his chest, a hairline fracture and the confidence that had always armored him. You're right. I handled this badly. I thought I was doing something noble. But I'm just repeating the same patterns of control and manipulation that made me cynical enough to run that test in the first place. They sat in silence for a long moment, the lunch crowd humming around them. A world of people conducting business and making deals, while something more fragile and honest hung in the balance at their table. Why did you really come to Mercy General that night? Natalie asked finally. What were you trying to prove? Jonathan looked down at his untouched water glass. I wanted to prove that compassion was dead, that the healthcare system was so broken that no one cared about patients anymore, especially poor ones. I was going to use that evidence to justify focusing all our charitable giving on facilities that serve wealthy patients, places where at least the money would be appreciated. And instead, you found out you were wrong. Instead, I found out I was mostly right, which was almost worse. 3 hospitals before yours, I was ignored or removed. Your Dr. Patterson treated me like garbage. But then there was you, and you were everything I had convinced myself didn't exist anymore. Jonathan finally met her eyes. I'm not good at this, at being genuine or admitting when I'm wrong, but you deserve better than the way I've handled this. Natalie was quiet for a long moment, studying his face. The promotion and the grant. If I turn it down, does Mercy General still get the money? No, Jonathan admitted. The board would revolt, and I'd have no leverage to demand the changes that hospital desperately needs. So you're holding the hospital hostage to get what you want. To assuage your guilt or satisfy whatever this is, she gestured between them. Yes, he said simply, because denying it would be another lie. Natalie stood up, and Jonathan felt a sinking sensation in his stomach that had nothing to do with hunger. I need to think about this, about all of it. But Mr. Pierce, if you really want to change how healthcare works, you need to start by listening to the people actually doing the work, not testing them like laboratory rats and rewarding the ones who perform well. She left him sitting alone at the table. And Jonathan discovered that even in a restaurant full of people, he had never felt quite so isolated. Patricia had been right. Grand gestures and manipulations, even well-intentioned ones, rarely produced the results he hoped for. What he had not counted on was that Natalie Brooks would see right through him and challenge him to be better than his worst impulses. And what he could not admit, even to himself, was that her rejection hurt more than any business failure ever had. The community health clinic on East Jefferson Street occupied a converted warehouse that had seen better decades. The paint was peeling, The waiting room chairs were mismatched donations, and the fluorescent lights flickered with the same tired persistence as the staff who worked beneath them. Jonathan Pierce, wearing jeans and a plain sweater, stood in the doorway, feeling more out of place than he had in his homeless disguise. "You, the new volunteer?" A woman in her 60s with steel-gray hair and shrewd eyes looked him up and down. "I'm Dr. Ramona Foster. We need someone to help with intake and basic patient assistance." "Can you handle bodily fluids without fainting?" "I believe so," Jonathan said, though he was not entirely certain. "Then you'll do. Grab a clipboard and start with the woman in the yellow jacket. Name, symptoms, how long they've been waiting. We're 3 hours behind, and it's only going to get worse." Jonathan had shown up at the clinic for days after his disastrous lunch with Natalie. Following 2 sleepless nights and a conversation with Patricia where she had suggested, in her diplomatically brutal way, that perhaps he should experience the healthcare system from the ground level without any disguises or ulterior motives. "Just go help people," she had said. "No tests. No plans. No expectations of recognition or reward. Just go be useful." The woman in the yellow jacket was named Lorraine Hughes, and she had been waiting for 2.5 hours to see a doctor about the persistent cough that kept her awake at night. She worked 3 part-time jobs, none of which offered health insurance, and had finally scraped together enough money for the clinic's sliding scale fee. "I'm sorry you've had to wait so long," Jonathan said. "Making notes on the intake form?" Lorraine shrugged, the gesture tired but not bitter. "At least there's somewhere to wait. County Hospital turned me away last week because I couldn't pay up front. This place actually cares about people." Over the next 6 hours, Jonathan took 23 intake forms, helped an elderly man to the bathroom, held a crying baby while his mother filled out paperwork, and cleaned up when a patient with food poisoning did not make it to the restroom in time. His expensive watch, which he had forgotten to remove, got splashed with something unidentifiable. His sweater acquired stains that would never come out. He also listened to stories. The single father, working 2 jobs, who brought his daughter in for an asthma attack, the veteran with untreated PTSD who needed medication refills, the college student who could not afford her insulin and was rationing doses in a way that made Dr. Foster's face go tight with worry. "We need $10,000. Jonathan heard Dr. Foster telling someone on the phone during a rare quiet moment. "The HVAC system is dying and we can't see patients if we can't keep the building at a safe temperature. I don't care if we have to hold a bake sale. Figure it out." She hung up and noticed Jonathan listening. "Rich people give millions to put their names on hospital wings, but places like this that actually serve communities, we have to beg for table scraps." She studied him more carefully. "You look familiar. Have we met?" "I don't think so," Jonathan said. Which was technically true. That night, exhausted and humbled, Jonathan returned to his penthouse and wrote a check for $50,000 to the East Jefferson Community Health Clinic. Then he tore it up. Dr. Foster had been right about rich people and their names on buildings. If he was going to help, it needed to be because it was right, not because it made him feel virtuous. He made the donation anonymously instead, through a third-party foundation that would ensure the clinic received the money without knowing its source. Then he called Patricia and asked her to arrange for him to volunteer at the clinic every Tuesday and Thursday for the next 3 months. "No press releases," he specified. "No one at the company knows. Just block off my calendar. You're really doing this," Patricia said. And for the first time in the 15 years she had worked for him, she sounded genuinely surprised. "I'm trying to," Jonathan admitted. On his 3rd week at the clinic, Jonathan met Grace Mitchell. She was 82 years old, her hands gnarled with arthritis. Her breathing labored from decades of working in factories before safety regulations meant anything. She had outlived 2 husbands, 3 siblings, and 1 of her children. And she came to the clinic because the pain in her hip had become unbearable. Jonathan helped her from the waiting room to the examination area, moving slowly to match her shuffling pace. "You're good at this," Grace said, settling onto the exam table with a grateful sigh. Patient. "A lot of young people rush old folks, but you let me take my time." "My grandmother had arthritis," Jonathan said, surprised by the memory. She used to say that moving slow wasn't the same as being slow. Smart woman. Us. Grace studied him with eyes that were still sharp despite their age. What brings a man like you to a place like this? What do you mean, a man like me? Oh, honey. I've been around long enough to recognize quality when I see it. Those jeans cost more than my monthly rent, even if you did get them dirty. You talk like someone who's used to being listened to. And you've got that look. What look? The look of someone who's figuring out that money doesn't solve the problems they thought it would. Grace patted his hand with her twisted fingers. I'm not judging. We all gotta learn our lessons somehow. The question is what you're going to do with what you've learned. Dr. Foster came in before Jonathan could respond, but Grace's words stayed with him. That evening, instead of going home, he drove to Mercy General Hospital. He found Natalie at the nurse's station, completing charts at the end of her shift. She looked up as he approached, her expression guarded. Mr. Pierce, I thought billionaires had people to deliver their messages. I've been volunteering at the East Jefferson Community Health Clinic, Jonathan said without preamble. Every Tuesday and Thursday for the past 3 weeks. Intake forms, patient assistance, cleaning, whatever they need. Natalie's pen stilled on her paperwork. Why are you telling me this? Because you were right about everything. I was trying to control a situation instead of actually helping. I was using money to manipulate people into behaving the way I thought they should. Jonathan leaned against the counter, suddenly exhausted. I met this woman today, Grace Mitchell. She's 82, lives on Social Security, and she told me that money doesn't solve the problems I thought it would. She could see right through me in 5 minutes, and I've spent 3 weeks proving her right, Jonathan. Oddly, it was the first time Natalie had used his first name, and something in his chest tightened at the sound. What do you want from me? I want to apologize. Really apologize, not just say the words. He met her eyes, letting her see past the armor he usually wore. I came to your hospital looking for evidence that compassion was dead so I could justify my own cynicism. Instead, I found someone who reminded me that kindness is a choice people make every day, often at their own expense. And instead of thanking you, I tried to reward you like you were a dog who had performed a trick. Natalie was quiet for a long moment. The promotion and the grant. What happened with that? Derek Hamilton is stalling, trying to find a way to take the money without implementing the changes. I told him this morning that if he doesn't have a concrete plan for reform by next week, I'm pulling the funding and offering it to County General instead. Jonathan ran a hand through his hair. I'm not going to force you to take a position you don't want. If you prefer to stay where you are, that's your choice. But I'm going to make sure that any hospital taking Pierce money treats all patients with the respect you showed a homeless stranger. I heard about the anonymous donation to East Jefferson, Natalie said quietly. Dr. Foster is over there replacing their entire HVAC system and buying new equipment. She thinks it was a miracle. Jonathan felt heat rise to his face. I don't know what you're talking about. The donation came 3 days after you started volunteering there. The clinic director mentioned a new volunteer who seemed very interested in their operational costs. Natalie's lips curved in the smallest smile. Tall, gray eyes, expensive watch, even though he was trying to dress down. It wasn't hard to figure out. You're friends with Dr. Foster? I volunteer there on my days off. Have for 2 years. Natalie closed her chart and stood up. Why do you think I recognized real need when I saw you that night? I see it every week at East Jefferson. Jonathan stared at her, a laugh building in his chest that was equal parts disbelief and wonder. Of course you do. Because you're not just compassionate when someone's watching, you're actually genuinely good. I'm not a saint, Jonathan. I'm just someone who thinks we have a responsibility to take care of each other. Natalie picked up her bag. Walk with me. They left the hospital together, moving through the parking lot as the sun set over the city. Jonathan told her about Grace Mitchell, about the stories he had heard at the clinic, about the way his perspective had shifted. Over 3 weeks of actually seeing how most people experienced healthcare. I used to think the system was broken because people were lazy or because regulations made efficiency impossible, he admitted. I thought money was the answer to everything. But the problems are so much more complicated than that. The problems are actually pretty simple, Natalie corrected gently. We have people who need care and systems designed to profit from their suffering. The complicated part is that fixing it requires people with power and money to give some of that up for the common good. That's not a systems problem. It's a values problem. They reached her car, an aging sedan that had seen better years, but was meticulously maintained. Natalie unlocked it, but did not get in immediately. I've been thinking about your offer, she said. The promotion, the grant, all of it. Jonathan's heart rate picked up, though he kept his expression neutral. And I'll take the position if you meet 3 conditions. Natalie held up her fingers, ticking them off. First, Derek Hamilton gets mandatory training on compassionate care, and he has to spend 1 shift a month actually working in the emergency room. Second, any nurse or doctor reported for discrimination or inadequate care based on a patient's ability to pay gets a formal review. And third, you personally fund an annual scholarship for nurses from low-income backgrounds who want to work in community health. Done, Jonathan said immediately. All of it. Whatever you need, I wasn't finished. Natalie's expression grew more serious. 4th condition. You stop trying to save me, or fix me, or reward me. If we're going to work together, or if we're going to be anything else, it has to be as equals. Not as a billionaire and the poor nurse who impressed him. Not as a philanthropist in his project. As 2 people who both care about making healthcare better. I can do that, Jonathan said quietly. Though I should tell you, I'm going to need your help. I'm very good at running companies and making money, but I'm not good at seeing people the way you do. I want to learn, but I'm going to make mistakes. Everyone makes mistakes. The question is whether you learn from them or just use your money to avoid the consequences. Natalie studied his face in the fading light. Grace Mitchell called me today. She told me a nice young man helped her at the clinic. She thought he was someone important, trying to figure out how to be good. She said I should give him a chance if I ever met him. She knew who I was. Grace worked as a housekeeper for 40 years. She's cleaned homes of people like you her whole life. She knows how to recognize quality even when it's trying to hide. Natalie smiled then, a real smile that made Jonathan's breath catch. She also said you held her hand while Dr. Foster gave her a cortisone shot, and you didn't even flinch when she squeezed hard enough to leave marks. It seemed like the right thing to do. It was the human thing to do. Natalie finally opened her car door. I start the new position in 2 weeks. Meet me at East Jefferson this Thursday. If you really want to understand how to make healthcare better, you need to see it from every angle, not just the one that makes you comfortable. I'll be there, Jonathan promised. As he watched her drive away, Jonathan pulled out his phone and called Patricia. Set up a meeting with the full board, he said. We're restructuring our entire healthcare initiative, and this time we're going to do it right. I want community health workers, nurses, and patients at the table. No more decisions made in boardrooms by people who have never worried about affording their medications. Quite a change from the man who wanted to prove compassion was dead, Patricia observed. I'm learning that the things worth having are the things you can't buy, Jonathan said. And the people worth knowing are the ones who see you clearly and challenge you to be better. 3 months later, the Pierce Medical Technologies Healthcare Initiative had distributed grants to 17 community clinics, established a scholarship fund that would support 50 nursing students annually, and partnered with Mercy General Hospital to create a model for compassionate emergency care that other hospitals were already studying.